Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about diabetes awareness, and joining me in the program is Dr. Daniele Drepaul, the coordinator of chronic disease, and Dr. Nandishaw Ramsingh, the technical officer for diabetes. Welcome to the program, Dr. Drepaul.
Thank you, Alicia.
So we're talking about diabetes awareness. Could you tell us the situation here in Guyana as it relates to diabetes?
So we have around 60,000 persons who suffer from diabetes, but this number could be higher because a lot of persons do not come in and get tested. So we're urging all to visit your nearest health center so you could know your status.
What strategies has the Ministry of Health adopted over the years to monitor cases of diabetes across the country, and not just monitor, but prevent those cases?
Okay, so I will firstly speak about our guidelines that we have updated last year. We have partnered with Mount Sinai Health Systems, and we have introduced new gold standard testing, which is the HbA1c. So as of last year to date, we have implemented about, or not implemented, we have given 80 centers HbA1c machines. So our main focus is primary health care. As we know, all existing regional hospitals already have these machines. So if you put these testing machines at the first level of care, it eliminates the person having to travel to the hospital to have this test. So it's right in the community. And it's free of cost, of course. So with that said, in our guidelines also, we're speaking about introducing some new meds, but right now we're in the talking stage. It's not here as yet, but we should look forward to this in the near future. So for now, we're still using metformin as our gold standard treatment for diabetes. Well, type 2 that is, because
Yes.
there are different types of diabetes.
Yes, definitely that's an initiative to look forward to. So, Dr. Drepaul, we've been encouraging persons to visit their health centers to access a variety of services. Could you explain the importance of not only diabetic patients, but other persons visiting those health centers closest to them to access services, especially diabetic care?
Okay, so normally we encourage persons to at least have a medical check annually. Um, Really and truly, in our chronic disease clinic, we encourage our doctors to send these labs at least every 6 months. But if it cannot be done every 6 months, annually it's okay. So you should not only visit your doctor to see if you're diabetic. There's an array of sicknesses, chronic diseases that you could have. So doing an annual checkup, we look at different things. We look at your kidneys, your liver, we do general tests, we do x-rays to look at your lungs, etc. So we do urge you all to visit and do request these tests. You don't have to be sick to get these tests done.
Definitely. We know that managing diabetes is a collaborative effort. So, what can persons do to reduce their risk of developing diabetes and help persons who currently have diabetes as well?
So we urge persons to modify their lifestyle. So firstly, you have to look at what you're eating. Eat a balanced diet. You have to look at your portion sizes. We know here in Guyana that we're accustomed to eating a lot of carbs, meaning that our plate is very filled with
Full.
rice. So that shouldn't be. Here in our department, we have a model plate, like your portion size. Your starch should just be a quart of the plate. Your protein should be like your fist, so you could use that to measure. You should have some vegetables also. And of course, daily you should eat fruits. So you should also exercise. When we speak of exercise, it's to get a heart rate pumping. You could do brisk walking, cycling. It depends on you because we're not sending everybody to do a marathon,
Yeah.
and so not everybody could do that. So whatever is good for you. If it is just walking at the seawall or if you have a nearby park or so, that That is a good form of exercise. Also, we look at toxic habits. We ask persons to stay away from smoking because we know smoking could cause a lot of problems,
Yes.
especially lung cancers and so on. And alcohol too, to reduce your alcohol content or no alcohol at all. Also, you look at your sleeping habits because you remember the body needs to rejuvenate itself. So some persons, they only get like 3 hours of sleep per night. That is not good. An adult should at least have 7 to 8 hours sleep at night. If it's school-age children, they will need a little bit more depending on their age. Younger children will sleep a bit longer than older children. So these are some of the things you have to look at.
Thank you so much, Dr. Drepaul. We are going to go into a short break and be right back with more on diabetes awareness.
Hello everyone, I'm Dr. Lachmi Lalo of the Non-Communicable Diseases Program. And in observance of Diabetes Awareness Month, we present to you on the 23rd of November at 6 a.m. at the Botanical Gardens, our Diabetes Wellness Village. We also want to encourage everyone to come out and participate in our Sweet Escape trail and road activity, which starts promptly at 6 a.m. We also want to encourage you to stay around, take advantage of our information booths and our activities to have screening done on the 23rd of November. Save the date and we look forward to seeing you there.
I am Glennis Alonzo Beaton. Today, as we celebrate World Diabetes Month, the month of November, come and enjoy with us in collaboration with the Ministry of Health through its Chronic Disease Department, Diabetes Village, Botanical Gardens, on the 23rd of November from 6 a.m. to 11. Come, walk with us, ride with us. Come, show us how you cook in your own kitchen, practical lessons where we can teach you all the different ways and means of getting your nutrition properly. This is a physical event. Please be sure to walk with persons living with diabetes, persons who work with people with diabetes, and have your blood sugar tested, your HbA1c. Insulin will be there for distribution. Feel free to enjoy World Diabetes Month.
Dr. Ramsingh, this year diabetes awareness is observed under the theme Empowering Global Health. Tell us about this theme and what does it mean to Guyana as well?
So for Diabetes Awareness Month, yes, it's about empowering global health. We are trying as a country to ensure that we have the standards that we want for our patients, for our population to know that they can be able to access equitable and equal health care. So we are also on this bandwagon of ensuring that, for example, our HbA1c testing and screening is done at most of our health centers. By next year, we should have all of our health centers offering this type of testing. So when we talk about empowering global health, we want not just our diabetics, but as a people to be able to be healthier and lead a better lifestyle.
Definitely. And on the topic of awareness, could you tell us what is diabetes? What is pre-diabetes? What are some of the signs and the symptoms should persons look for?
So diabetes, a lot of persons would hear, oh, diabetes, and they automatically think, oh, it's sugar.
Yeah.
Right? So that's like the common term that we use here. But diabetes, and we want persons to take it very seriously, it's a chronic disease, meaning that it's long lasting. It's there for life. There aren't a lot of things that persons are going to say that, oh, we can be able to do, but really and truly, if they access the care and if they access their health centers, their doctors, nurses, healthcare staff that are willing to sit down with you, talk with you to let you know, yes, you may have diabetes in your family. It doesn't mean that you need to become a diabetic too. Like you said earlier, Alicia, there is pre-diabetes. There are different range of or types of diabetes. There's pre-diabetes, gestational diabetes, which is diabetes in pregnant women. We also have our famous type 1 and our type 2 diabetics. So when we talk about diabetes, basically what's happening is that in our body, there is a hormone called insulin. And this insulin, when we eat our food, we're supposed to be able to get energy from this food. It gives us our glucose, which is our sugars. But what happens is in some bodies or in some of our bodies, the insulin isn't there enough. And this is like, for example, in the type 1. So the insulin isn't there enough to break down these blood sugars or the glucose that enters into our body. For example, in the type 2, there is some amount of insulin there, but it's not enough as well. So the type 2s, we encourage them, for example, to use their medications such as metformin,
Yes.
glycoside, and so forth to help to control that. Now, for me, out of all the types, pre-diabetes is something we need to focus on because when you're a pre-diabetic, you actually have a chance with encouraging healthy lifestyle measures that you can be able to use at home before reaching the stage of becoming a
Yes.
type 2 diabetic. So we encourage all persons who are 25 years and older to get screened, get tested, know what your blood sugars are, do your HbA1c testing. This can be able to actually save your life and save yourself from having different complications because diabetes, it's not just about being a diabetic, it has complications. There are foot complications, eye complications, kidney complications, heart complications. So diabetes is very serious and we want people to understand that, just because I'm a diabetic doesn't mean that the care doesn't exist, doesn't mean that there aren't things that we can do to help to lower blood sugars in our body so that we can be able to lead a healthier life.
Thank you, Dr. Shaw. For persons who may be experiencing some symptoms and not sure what it is, what does diabetes symptoms look like?
Okay, so for a person with diabetes, so let's start from the kids. One thing that we usually try to encourage parents, if you notice your 5 or 6 year old, we know they would have, when they're smaller, they would wet the bed. But if you notice that they have grown out of that, at a 5, 6, 7 year old, you find that they suddenly start wetting the bed, that's an abnormal pattern for them. And that's one of the signs in the clinics and so forth that we have. We notice parents would complain about that. And when we do test those kids or we do have them screened, it turns out that they're a type 1 diabetic. Now, for the older persons, we find that if you find yourself drinking a lot of water, thirsty, not because of the heat, but an abnormal amount of water, that is one sign. Using the washroom frequently at night, that's another sign. If you find that you have itching on your skin, you're having like some rapid weight loss happening, these are signs that you should go and check with your healthcare provider to see if, at least get screened. Maybe this is the starting of me being a diabetic. And remember, like we usually encourage the population, our residents, if your family, especially your immediate family, has someone who's a diabetic, like your mom or your dad, then you should take the initiative to get screened because there is a probably 50 to 60% chance that you will become a diabetic.
Definitely. What can family members do to care for others or their loved ones with diabetes?
So mental health is something really big, and we love to stress on it because persons think that you need to have a disability in order just to support a family member. But having a disease, especially a chronic illness, everyone needs that support. We want them to be able to know that accompany your relatives if they need to go to the health center or to their clinic visit because sometimes your relatives are old and they're not gonna probably pick up on what the doctor or the nurses are saying. So be there for them. Let them know that you're supporting them through this process. You want to encourage them to at home to eat a healthy meal. Like Dr. Drepaul would have said earlier in her interview, this we call like a healthy plate. You can be able to see how to at least portion off your food. Diabetics have this very nonchalant kind of vision that, we can't eat this, we can't eat that, but it's the amount that you eat. And this is something we stress on for patients that you need to eat healthy, you need to eat right, and you need to eat balanced. We even encourage patients to like have their own kitchen garden. It doesn't have to be something very, abundant and outlay. You can grow a little bit of everything that you may like. So we encourage these kind of family support in this way. Looking after your relatives, especially the older ones. A lot of older persons, they can't check their feet.
Yeah.
Right? And we have this very prevalent in our country, diabetic foot complications, where persons are getting amputations just because of things that they could have avoided or a relative could have been able
Cuts,
to help them.
ulcers,
Exactly.
and
So
things.
you can be able to check your relative feet, ensure they don't walk barefoot in the house or in the
Yes.
yard. Look at the type of shoes that they wear too. open foot shoes, we do not recommend. If they're walking, give them a white socks. You can be able to easily see if there is a blood stain there or so. So these are just like the few nitty-gritties. There's so much more that we can be able to talk to, but these are like the important things to get family members more involved in their patient care for their relative.
Definitely. Dr. Ramsingh, could you tell us the importance of daily exercising? And I know when persons hear daily exercising, they're thinking, oh, I have to go to the gym. But I know a simple walk in the park or a simple walk around the house or around the block is exercising, and that matters too.
Yeah, and definitely, Alicia, like we encourage persons. A lot of persons say that we're at home and we're doing housework. But we want to define that housework is not the same as physical activity that is meant to help your body circulation or get you to that physical fitness that you may want.
Yes.
So you're right. We encourage persons, if you ride, just take your bicycle, ride around the block. You don't want your neighbors to see? No problem. You can do there are different ways. There's yoga, there's Pilates for the women. I know women are into Pilates and yoga these days too. Do some of that. The reason we want you to do at least 30 minutes of physical activity is just to get the heart pumping a little so that, it helps with circulation. And even talking about this, obesity or being overweight plays a really big part too in persons who are diabetics, or we should say one of the risk factors of persons who may lead up to be like a type 2 diabetic. So exercise is definitely important. There are a lot of if you don't want to do it in your neighborhood, there's a national park. You can go there. You can use the seawall. But riding, if you don't want to ride, walk, or run, there is dancing. So dancing helps a lot too, because you have to find a way in which you can be able to move. Because what we want is Guyana to move.
Yes.
Also, Alicia, let me just also include that there is a complication by the name of diabetic retinopathy. In simpler terms, it's basically when diabetic persons, when they have uncontrolled sugars, it can affect your eyes. Now, a lot of persons may or may not know this, but the higher your sugar levels are, and the longer you take to control those sugar levels or to bring them down, then you are literally blocking some of your vessels that run in the eye. This is the retinal part of the eye. So when this happens, this is how diabetics can actually have vision loss. And it occurs in type 1 diabetics too. So even though, we would have talked earlier about diabetic foot care, looking at foot complications, your eyes are also very important. And that's why we encourage patients, like, maybe when you go to the health center or your clinic, to ask about it. Don't be afraid. Like, there is no wrong way to ask. Say, doc, nurse, I would like to do an eye exam. If it is that you find like you're seeing a bit blurry, one of the main symptoms for diabetic retinopathy patients is that they would see like some small dust like floating in front of them. So if if the patient or so notice that, and we're encouraging family members to, if your relative is complaining of that, then let them get the eye examination. It doesn't hurt. The eye examination takes about 15 minutes, and we have a lot of we have places like GPHC, we have East Penitence. These places actually offer eye examinations for the retina.
Before we end today's program, Doc, can you tell us about the Sweet Escape event the Ministry of Health is hosting?
Oh, so we're encouraging everyone to come out on Saturday the 23rd from 6 a.m. to 11 a.m. We have a walk and run, and then we have a diabetes wellness village setup. This is free of cost, by the way, to come and see this diabetes wellness village. We'll have a lot of healthy vendors. We will be doing testing, screening. We'll also have a cooking show that will be happening as well. And we will also be in the upcoming time promoting our type 1 diabetes storybook that we brought out, because we really want kids and parents, not just who are diabetics, to know that, you can be able to support your friends in school if you know that they're diabetic. So this book will actually be launching very soon as well, and there will be a reading at the Wellness Village for it. But we want to encourage persons to come out. Diabetes is very important. Just because you're not a diabetic doesn't mean that you shouldn't know. A lot of the lifestyle changes that a diabetic person goes through, it's actually a very healthy way for somebody without diabetes to pick up or to be able to lead, to lead a better or a healthier lifestyle. So we're encouraging everyone to come out. The Botanical Gardens, the 23rd of November, 6 a.m. to 11 a.m.
Thank you so much, Dr. Ramsingh, for joining me in the program today. And I want to encourage you and your department to keep up the good work that you guys have been doing.
Thank you, Alicia. You know, it's always a pleasure being here.
I'm Beyonce Atkinson, Marketing Coordinator of FAG, that's the Tourism and Hospitality Association of Guyana. And we're happy, along with the PAC, to collaborate with the Ministry of Health on Sweet Escape Trail Run and Walk. Join us on November 23rd from 6 a.m. to 11 a.m. for a Sweet Escape, promoting wellness and tourism. Let's walk, run, and bike together.
Hello there, are you ready to make stride towards a healthier you? Join the Ministry of Health, Stride 592 and other partners for the Sweet Escape Trail and Road on Saturday, November 23rd at the Botanical Gardens, starting from 6 a.m. to 11 a.m. We're celebrating Diabetes and Tourism Awareness Month with an unforgettable day of activities and wellness. Take part in a 2K or 5K walk, run, or bike. Whether you're moving at a sprint, jog, or leisurely pace, this event is for everyone. Visit our wellness village featuring nature activities, fun games, sustainable vendors, and so much more. It's a day to focus on health and celebrate wellness with your community. Register now at stride592.com. Don't miss the Sweet Escape Trail and Road, because every step is a step towards health.
Thank you for staying tuned with us. I'm Host-Alicia Martin saying goodbye for now. Remember to stay tuned to the Ministry of Health's Facebook page for all of your health updates.